So hi, everybody. I'm here today from the Valley Hospital. I'm literally located at the Valley Hospital. I'm a social worker. I've been here for 21 years doing social work on the inpatient units and occasionally floating to some of the outpatient units, helping people with discharge planning and questions about resources and things like that. So Sue asked me to come on to talk about a little bit about Medicare, Medicaid, and other community resources. So if you have any questions while I'm talking, please write them in the chat. I'll see, if I can see it, I'll try to address it as I'm talking. Otherwise, you could save for the end.
The end one, it says recording. Okay, honey.
Okay, you're recording. I can hear you. You're recording.
Okay.
Okay. So the first part is Medicare. I think Sue had sent out a few attachments, so those are really helpful. And first we'll talk about Medicare. I'm not sure how many of you have Medicare or are thinking about joining Medicare, but getting close to that age. This is also timely because it's coming up to open enrollment, which begins on October 15th through December 7th. So just a little background about Medicare. Generally, if you are 65 years and older, if you are under 65, blind and or disabled, then you may be eligible for Medicare. Also, if you have end-stage renal disease requiring chronic hemodialysis, or you have been diagnosed with ALS, Lou Gehrig's disease, you may also be eligible for Medicare. There are 4 different parts to Medicare. There's Part A and B, which most people are familiar with, the hospital benefit, and also the medical benefit. There are multiple benefits underneath each one. So it's not just hospital. So if you have Part A, it's inpatient hospital stay, acute rehabilitation like Kessler, acute dialysis if you're in the hospital, require acute dialysis care, skilled nursing care or home care, inpatient skilled nursing facility where you may have gone to rehab after a hospital stay. It also covers hospice care and emergency ground transportation. It also covers covers some injectable medications like chemotherapies and things like that. And the out-of-pocket costs for each one of those different services vary. So you may want to check out medicare.gov to see any particular benefit information. Part B, known as medical, is doctor's visits, lab visits, x-rays, durable medical equipment, including oxygen, walkers, commodes, diabetic supplies, things like that. Also covers outpatient hemodialysis and routine ground ambulance transportation. So if you're in the hospital and you come to the hospital, it's covered under Part A in an ambulance. If you leave the hospital in an ambulance, it's covered under Part B. Also, the one thing to be aware of that if you are eligible to enroll in Part B, if you delay enrolling in Part B and you didn't have creditable coverage, then you may be imposed a penalty, may be imposed, a lifetime increase in your premium would be imposed on that. Part C is an advantage plan. So if you decide to enroll in an HMO, those are so they basically pay for your original Medicare. There may be some additional benefits that they provide, like dental, eye care, which regular original Medicare may not provide. Again, there's different enrollment periods for these and when to do it. If you're working, not working, if you have a spouse that's working and you're eligible for Medicare, certain things to consider. And one of the attachments that Sue had forwarded it's a great little booklet, Medicare decisions for those over 65 and planning to retire in the next 6 months, but certainly important to read. You could read it at any time. And then there's Part D that started in, I think, 2006, which is the prescription drug coverage. And again, that's important to enroll when you are eligible for Medicare. Otherwise, if you delay, if you didn't have creditable coverage under an employer plan or some other kind of group plan, then you'll be imposed a lifetime benefit penalty, like a increase in your monthly premium. One thing good to know is that if you didn't enroll, then you could enroll during open enrollment, which is starting next month. But if you enroll in PAAD, if you're eligible in the pharmaceutical assistance for the aged and disabled in New Jersey, that's what it's called for someone who may be lower asset. They do not look at lower income, rather. They don't look at assets. So whatever you get from Social Security or a pension or even investment money that counts as income, you can look at that. There's a great website. Just Google NJ PAAD, PAAD. But if you enroll in PAAD, you don't have to wait till the open enrollment period. You can join anytime. And then also they like to talk about, the things that aren't covered by Medicare. Many times there are out-of-pocket costs and deductibles. You could join a Medigap or supplemental plan. You have, I think, 6 months from when you initially initially eligible for Medicare to enroll in a Medigap plan with no questions asked. After that, it's open enrollment all year long. However, you could be denied due to pre-existing health conditions. You have to pass a physical type thing. So it's important, if you want to consider that, to do that when you're first eligible. Some people want to say, well, what am I going to get out of my Medicare benefits other than just going to the hospital? So you want to consider, visiting nurse services. If after a hospital stay, it might be eligible for a nurse for any kind of teaching about a new medication or physical therapy, home occupational therapy, things like that. Also, it covers some home health aid time temporarily while you're rehabbing, maybe at home and convalescing. Could cover the skilled nursing facility after a hospital stay. If you have an HMO Medicare, you don't necessarily need to be in the hospital. You can go from home because you can get authorization from home to go into a skilled nursing facility if you have an HMO. And the durable medical equipment that could be covered. So I don't know if you have any questions. Are not popping up yet under Medicare. Also, I did give a flyer that's from the state called the Getting Help Paying for Your Medicare Costs. So if you happen to be low income and or low asset, then you may be eligible for some of the programs to help pay for your Medicare Part B and Part D premiums. And there's a great resource in every county in the United States called State Health Insurance Assistance Program, or SHIP, SHIP. They leave off the A. But there's certified volunteers that have been trained on how to do Medicare counseling, and they are wonderful. It's where I learned a lot of my information from them, and they have some great information, and they're always happy to help. So that's a really good resource to use if you have questions about choosing Medicare or changing any plans. So Medicaid, there's lots of different Medicaid programs. So, and people tell me all the time, oh, I'm not eligible for Medicaid. And it turns out they are eligible for Medicaid. They just don't know because there's so many different programs. So primarily the ones that would be appropriate to talk about for people who are over 65 or are disabled. Under 65 would be the New Jersey Family Care Aged, Blind, and Disabled programs. And there are specifically 2 programs under that umbrella. One is called Aged, Blind, and Disabled. So aged over 65, if you're at any age and you're blind, or any age and disabled. However, if you are over 65 and you're filling out an application for this program, do not click that you're disabled, because it'll put you in a different program. They'll ask you for all kinds of documentation about your disability and just more headaches. So you're just at that point aged. So aged, blind, and disabled is a full insurance plan. You never lose your Medicare, even if you're apply for Medicaid. Medicare would always be primary. But it would help cover some of those out-of-pocket costs that Medicare doesn't cover. To be eligible for, there's different criteria. So aged, blind, and disabled, if you're over 65, blind or disabled. I think if you're single, it's $11.94 a month income, and it's about $1,400 a month as a couple, and you can't have more than $6,000 in the bank. If you need, it does cover dental care, eye care, eyeglasses, really any service you need. If you need more care because help at home, like a home health aide or considering assisted living and or nursing home level of care, there is another Medicaid program called Medicaid Long-Term Supports and Services, or MLTSS, and that would cover the room and board cost of a facility, or it'll cover some care at home in a home health care at home. And the income criteria for that, there is a threshold, but I always tell people don't worry about the threshold because you could still apply. There's just an extra step to the application. So when you apply for the MLTSS program for care at home, assisted living, or in a nursing home, they do have a cap of $25.23 a month, $2,523. But if you're over that, and that's just whoever the applicant is. So if it's the wife and the wife makes under $25.23, great. Her assets have to be, generally speaking, below $2,000. But there's ways to, if it's a single person, it's $2,000. You can't have any more than that. If it's a married couple, then there's some wiggle room that some of the monies could be put in the spouse's column so that they could still apply and be eligible. So never say never that you're not eligible until you really speak to somebody who knows what they're talking about, because a lot of people think they know, but they don't. And so it's really important to speak to the right person. There's also a medical criteria for that level of care. For the MLTSS program, you have to require at least assistance with 3 activities of daily living. So bathing, grooming, toileting, eating, transferring, dressing. So any 3 of those, or some sort of cognitive impairment, helping with decision making and things like that, could qualify you. I think what else? And just some other general, and some other services that MLTSS provides. It also provides care management in the home. It can do home and vehicle modifications. It pays for home delivered meals. It can cover respite, which basically means temporary care, either at home or in a facility. If the caregiver, the primary caregiver, is sick or needs to travel for some reason, so that's helpful. Covers personal emergency response systems like Lifeline. It also covers mental health and addiction services. So it's a all-inclusive program. But again, if you're eligible for Medicare, Medicare would be primary. And then there are some other programs within Bergen County and other counties as well. Bergen County offers a care management program through the ADRC, the Aging and Disability Resource Connection. So you could give them a call. Information is in the attachments that Sue sent out, and they can help you to assess whether or not you might be eligible for any one of the programs that we talked about today, or other programs that might be around. The Meals on Wheels, the lunch program system, they do offer some financial assistance if needed. Senior activity centers you may be familiar with. They're located all over Bergen County. They also have a reverse mortgage counseling program if you're interested in considering for that. And then I think I had sent on the last page of the Medicare Medicaid summary, I think it was, there's a key services guide for older adults and caregivers. It's like a 60-page resource that talks about every kind of service that's available for seniors and older people in the county and caregivers. There's a really interesting website called benefitscheckup.com. So you go onto that portal. It's a government website. It'll ask you maybe 20 questions about yourself and your spouse. A lot of demographic questions, where you're living, your income, your assets, if you're veteran, not a veteran, if you're disabled, not disabled, and it spits out a list of any program that you might be eligible for. So it's a really good place to start if you're looking to see what you might be eligible for. Valley Health System offers a website called Valley Cares. It's a really good program, website that just talks about all kinds of programs for medication assistance programs to help pay for medications. It talks about medical clinics, medical treatment, outpatient rehab, hospice, end of life, all kinds of programs like that. Two interesting programs to point out. If you have someone you know that is struggling with getting their bills paid and it's just overwhelming for them, Bergen County does have 2 free grant programs that offer assistance for helping someone to pay their bills, not paying for the bills, but helping them write out checks and managing their money. So the 2 I mentioned in the resource is Silver Bills Concierge Bill Management Program and Senior Checks Money Management Program. Again, those are both free through Bergen County. The county also recently started offering free Uber rides through the Bergen County CAP, Community Action Program, I believe it stands for. So they, right now, I think they're offering about 4 free round trip Uber rides a month per participant, and they'll take you to any doctor's appointment, either in Bergen County or outside of Bergen County if you need to cross counties. And it's, you give them a call, you can either join their app or you can call them or email them to set up any appointments. It's a very nice program. I don't have anything else. We kind of zipped through it. I guess didn't want to overwhelm too much.
It's great information. Thank you so much, Karen. Just, an appreciation for all the handouts. They're going to be so very, very helpful. Someone did ask about the penalty fees. Do you know generally what they are by any chance?
Yes, I believe that what they do is they add on 1% for every month that you delayed enrolling.
Oh,
So if you
geez.
delayed enrolling 6 months, then it's 6% times whatever your normal premium would have been, and that continues for the rest of your life.
Wow.
Yeah, I
Good
believe
to-
that it's 1% for every month. I'm pretty sure that's correct.
Okay. That is really something. And I agree with you about SHIP counselors.
Yeah,
So
really
very
good.
helpful.
Yeah.
Just really, I know we used to have a SHIP counselor at Valley. I don't know if we do anymore. In community health, we did a long time ago.
Have a counselor at Valley?
Yes, we
I
did. Don't think
no,
we
I
do
don't-
anymore though.
No, I mean, I would probably know her.
Yeah.
I mean, I call them all the time. I have
Great.
a contact there that I reach out to, and she's amazing. But they're all, and when you call, sometimes you have to leave a message.
Okay.
But they usually call me back. Always leave a detailed message. Ask what your question is, and they'll call you back with an answer. They'll either leave a message, but they always call back within 24 hours. Really good.
Excellent. Excellent. And yes, and Valley Cares is very helpful. Really, really helpful for guidance. I always tell people there's a lot of resources out there. It is a little tricky to access them sometimes for sure, or get responses, but you keep trying.
Right.
And I think that you will. Well, thank you so much, Karen.